No other culture has as ancient a history of sex as India does, and ironically, it is one of those cultures today where sex is talked about in hushed tones. Because it's considered taboo to discuss sex, not just in rural but urban cultures as well, there are many who suffer in silence, men and women both. Here are a few pointers on when you should break the silence and visit a sex therapist. Is sex and its importance overrated? No. The label of taboo on sex implies that our mentality is that sex is a sin or an act meant only for pleasure, but that's not it. It goes beyond that, and what better proof than our ancient scriptures? Sex was considered a path to spirituality, but not just that. Simply put, sex is an outcome of any other bodily need or function. Just as the body needs to eat, sleep, and breathe, it needs sex too. Humans are hardwired for it, and it has a direct effect on our health and mind. What is sex problem? The biggest downside of this mentality is that problems related to sex get brushed under the carpet. These issues include erectile dysfunction, ejaculation disorders, low libido, and pain during intercourse. Although treatable to a large extent, issues related to sexual dysfunction need to be discussed first, which is where people fall short. Mostly because they either think it's not serious or they're too embarrassed to discuss it. How do you know you have a problem? For men, low sex drive, inability to maintain erection or have an orgasm, lack of ejaculation, bloody ejaculation, and persisting erection are some of the problems. In women, sexual dysfunction manifests itself in the form of lack of desire to have sex, painful intercourse, maintaining arousal during it, or lack of orgasm. Continuous signs can cause considerable distress between partners and affect their relationship. A simple yet clear indication of whether this is likely to be a problem is that it persists. What might cause sexual dysfunction? In men, erectile dysfunction may be caused by diseases that affect blood flow, such as atherosclerosis, nerve disorders, stress, and performance anxiety. Loss of libido can be caused from physical or mental factors. Diabetes, high blood pressure, and even certain medications can cause this. There are many more causes for sexual dysfunction, but these are the most common. In women, sexual dysfunction usually occurs following a change in hormonal activity, such as after a birth or during menopause. Cancer or heart diseases can also play a part. When and why you need to visit a specialist. The obvious answer is when your sex life is in trouble and it is affecting other aspects of your life. Because you may not even realize it, it is important to consult a doctor no matter how small the issue seems to be. It's unfortunate that one's sex life, particularly in India, is considered a low priority, but it's important to understand that it can affect you in ways you don't know. If you are too embarrassed to consult a specialist, find a friend or a family member you can confide in. But as much as possible, you must be able to discuss it with your partner. It might appear unthinkable to some, but it's a step in the right direction. Course of treatment. The treatment begins with routine tests and examination by the doctor, who might suggest you to get a checkup done with other specialists like urologists, gynecologists, or endocrinologists. Make sure you do a full disclosure about whatever medicines or supplements you take or have taken in the past. The best practice in sexual health issues is to talk to your doctor. Communication is of utmost importance when one is dealing with sexual health issues. In men particularly, treatments may involve medications, Viagra for instance, hormonal supplementation, psychological therapy, and mechanical aids such as penile implants. For women, the treatment may include hormone replacement therapy for those suffering from vaginal dryness and discomfort during intercourse, topical estrogen applied as a cream, or surgery for cysts and tumors. However, not all treatments are suited to everyone, and the risks of some treatments are still debatable. So be sure to ask the right questions before your doctor asks you to proceed. Apart from regular treatment, couple therapy is also effective. Therapy helps couples find out the root of the problem or if it's related to a past problem such as sexual abuse during childhood. According to Dr. Vijaya Sarthi Ramanathan, a practicing sexual health physician and medical sex therapist, people need to be educated about what's normal. As sex education is often neglected in India and even parents don't talk to their kids about it, people don't know what's normal and the range of normality. Another key strategy is to figure out whether the problem is of the mind or body. Further treatment would be based on that. Education is the key. What can I do from my side? The healthier you are, the better your sex life. It's that simple. And that means no smoking, controlled drinking, not stressing, sleeping well, being physically active, and of course, eating healthy. If there are over-the-counter pills, why do I need a specialist? Yes, there are drugs for erectile dysfunction that are available over the counter, but how do you know that's the correct solution? For all you know, your problem might be caused by a blood pressure problem and not performance anxiety. And women can buy hormone pills for their issues, but again, how do you know that's the perfect solution? A specialist is required for a correct diagnosis, and if your problem is more serious than you perceive, would you rather treat it yourself? Obviously not. Now, if a woman is facing vaginal dryness, she can try a lubricant to see if it helps, and if the problem still persists, she can approach a doctor. However, Dr. Ramanathan adds that it's imperative to seek help from a proper source. For example, when one reads something on a website, one shouldn't judge the validity of the information based on its look, but should rather check for information credibility and if that particular information is being endorsed by a specialist. The last one. Sex-related problems in India are like the elephant in the room. Everyone knows about it, but no one's willing to talk about it. And as long as that happens, there's very less hope for those suffering in silence. And for what? A simple problem that could be taken care of simply by discussing it. So stop suffering and start talking. It's the best way out.